My name is Heidi Dreyer. I am a second-year medical student at the Idaho College of Osteopathic Medicine, and you are listening to Do or Do Not. We are lucky to have a special guest today, Dr. Jamie Lanzillotta. In prior episodes of our podcast, we have tended to focus on the excitement of specialties such as neurosurgery, emergency medicine doctors who work on the front lines saving lives. Today we host a different type of superhero who, in my opinion, is more impressive, a doctor who can balance her career and her family, making sure that her 3 children feel just as important and well cared for as her patients. Dr. Lanzillotta practices general pediatrics on Long Island in New York. She graduated from NYIT, College of Osteopathic Medicine, and completed her residency in Baltimore, where she served as chief resident. Today, Dr. Lanzillotta will highlight the pros and cons of career in pediatrics. She will describe the differences of working in a small private practice where she took her first job after residency, and the larger multispecialty group where she is currently employed. Dr. Lanzillotta will help us understand the challenges that face a physician, working mother, and give us tips that help guide women in medicine who are considering a similar career path. Dr. Lanzillotta, thank you so much for joining me today. We're really excited to have you on our podcast.
It's my pleasure. Thank you for having me.
So can you go ahead and start with what your normal day looks like?
In the morning, it's just basically getting everybody prior to COVID in and out of the house, getting ready for school. I have 3 children. And then once everybody's sort of on the road, I head into the office in an outpatient center where I work with 2 other physicians in a general pediatrics practice. I usually arrive around 8 a.m. and I start my day with well visits mixed in with a couple of acute visits if there's anything that happened overnight. I pretty much see patients straight through on a 15-minute basis, 1 patient every 15 minutes until around 12:30 when we take a break to answer phone calls and grab a bite to eat. We then start up again, same exact situation in the afternoon, doing the same thing, seeing a mixture of well visits and sick visits, acute visits. And at some point during the afternoon, usually it's a 1-hour chunk of time, we do an hour of telehealth where we see patients virtually. This is new since COVID. We will connect with our patients that don't have acute issues like fever and things like that. Maybe they have a rash or they have a question about something, and we connect with them virtually during that hour. Then I head home, and we have a babysitter that takes care of our children that when I get home, she leaves. We do dinner and start to think about homework, bedtime, and all that good stuff.
That's a pretty busy day.
Yeah, it ends up being full.
Because of COVID, you said you've had to start doing telehealth visits?
Telehealth is a very good way for me to connect with patients when they are having issues that aren't necessarily acute medical issues. For example, in our practice, we treat a lot of depression, anxiety, and mental health issues. It's been a huge help to be able to connect with patients over telehealth when it's not easy for them to come to the office with their schedules and things like that. So it's made it actually much easier for me to talk with them and connect with them and keep in touch with them when it's issues surrounding mental health. The other thing that's been amazing are quick little things like rashes. Pediatrics, we have a lot of rashes. We have eczema, we have viral rashes, we have all kinds of different rashes that are quick visits. And for patients not to have to come in and just to show it to me virtually and know what the diagnosis is, it's been kind of life-saving.
When and how did you become interested in medicine and decide you wanted to be a doctor?
So when I went to college, I went to Emory University, and I went with the goal of becoming a physical therapist. That was kind of my interest and passion throughout high school and sort of going into college. And I did some volunteer work at a local children's hospital in their physical therapy unit, and I really did not enjoy it as much as I thought I would. At that point, I started to think about what I would enjoy in the medical field. And I had several friends at the time that were in medical school talking about their experience and about what they were doing. And it seemed really exciting and wonderful. And I decided at that point that I would sort of change my direction to gear towards medical school.
Were there any experience there that led you into medicine or osteopathic school?
Yes, I definitely had some experiences that geared me towards medicine. I volunteered at a hospital called Grady Memorial, which is a hospital for underserved patients. And I guess I can only equate it to Bellevue in New York City, which is just a really amazing facility and was, I think, the true factor that really pushed me in that direction of going into medical school.
How did you first learn about osteopathy?
I first learned about osteopathy from a family friend whose father was a cardiologist, and she was pursuing osteopathic education. I also learned about it from another family friend who was a family practitioner and allowed me to shadow her and speak with her and interview her.
What made you choose the school that you chose to attend?
To be honest, it was a geographic decision because my family is all on Long Island. And so I felt that during the 4 years of medical school, when I would probably require a lot of free meals and a lot of help and assistance, that it would be good to be close to home. I had previously been in Georgia, and then I actually did a Teach for America program in Maryland. So I was happy to come home for those years. Just by having family nearby, I remember at NYCOM, we had exams every single Monday. It was just kind of the way that they structured the program. And my dad would always come on Monday evening and take me out to dinner. And he was trying to get me to do a yoga class, which I didn't like, but it was just having that support model in place, I think made it so much easier.
That's so sweet that he did that.
I know, it was really kind of cute.
How was your experience at school?
It was wonderful. Overall, the only issue with NYCOM is that it's a very large program, so lots and lots of students, which I felt a little bit overwhelmed by coming from a smaller private college. It was kind of hard to get used to being in these like enormous lecture halls with so many people, and also just kind of feeling it was hard to connect with professors because there were just so many students. But the quality of education was excellent. It was a great learning experience. Certainly the third and fourth years rotations were absolutely amazing, and I learned so much. So I think it was overall an excellent school.
So did you do any extracurriculars throughout medical school or had on-the-side jobs? Or I know medical school is already crazy busy.
Yeah, I really didn't do that much extracurricularly during medical school. I happened to meet my husband prior to starting medical school, and we then were long distance throughout the entire 4 years. So it was kind of us commuting back and forth from Baltimore, trying to keep up a long distance relationship. And whenever he had some free time, we would try to get together and vice versa. But I was a big studier. I pretty much studied nonstop. So I didn't really have much time to do much of anything else. I exercised, I definitely kept up with my physical and emotional health, but I didn't really find time to do much of anything else. We were both in school. He was doing rotations and I was in my first 2 years in the beginning. So that was hard to sort of reconcile. He had a little bit more free time than I did because he was doing the rotations, but not the academics. We kind of just stayed in touch by making sure we saw each other at least once or twice a month and speaking every day.
Did you do any research throughout medical school or prior to medical school?
I actually did not. I had a research requirement through my residency, and I did a study on asthma and pulmonary function testing. But for the most part, research has never really been something that I'm interested in at all, unfortunately. I'm more of a clinical person. Like I definitely prefer to see patients, and you can do research with seeing patients, of course, but I wasn't really interested in doing any bench work at all. And I just preferred to just see patients. That was always my thing.
Did you take the USMLE?
I did not. I took the COMLEX Part 1 and Part 2.
Do you think that taking the USMLE would have opened any doors for you, or do you think that you only needed to take COMLEX and that's what you needed?
For a general practitioner like myself, I don't think it was necessary to take USMLE, but the students in my class that wanted to pursue surgery, dermatology, different competitive fellowships, ophthalmology, they all took the USMLE.
Okay, were there any specific people or professors in medical school that you met who you think were really special to you or that you still have a connection with today?
I definitely felt very connected with the family practitioners that I worked with. They taught me so much, so many practical things. Even the simplest thing like drawing blood, it was something that I still take through my entire career, and I'm so good at it because of them. So they really were amazing mentors, and I really enjoyed my time with them. I didn't end up going into family practice, but I really felt that they were really pivotal in teaching me some of the real important things about medicine and about handling patients and interacting with patients. So yeah, they were excellent.
Where did you do your clinical rotations?
I did my clinical rotations in a variety of hospitals on Long Island, as well as in the Bronx and in Brooklyn. We at NYCOM rotate through many different hospitals. I did my pediatric rotation at St. Barnabas and also at Good Samaritan Hospital. I did a sub-internship in pediatrics. I did my OB at Good Sam as well. And then I did my psychiatric rotation at Lutheran in Brooklyn. And then I did my medicine rotation in Newark, New Jersey. So it was a plethora of different settings.
Yeah. Did you do any audition rotations in peds? And do you think that was important to do in order to get a peds rotation?
I did do the sub-I at Good Samaritan, and I think that definitely was important. I happened to kind of know where I wanted to do my residency because my husband was already practicing in Baltimore. I mean, he was doing his residency in Baltimore. So there were a couple of opportunities. So what I did in my fourth year is I did rotations in those hospitals, just like you said, to showcase myself.
How did you decide on general pediatrics?
That was actually back in medical school during my third year when I rotated at St. Barnabas in the Bronx. And the rotation was just phenomenal. And I enjoyed it so, so much. And that at that moment, I knew that that was what I was going to do. So that was it. But then it further became solidified as I did all the sub-internships and the showcasing rotations and stuff like that. I just knew that was it. That was what I was meant to do.
Did you ever consider a subspecialty?
I did. I considered doing pediatric infectious disease or doing pediatric GI, but I ended up not wanting to continue with another 3 years of fellowship and also the research component, and knowing that the research component was so heavy, because in all the peds fellowships, the research component is very heavy, and I just had zero interest in that.
How was the application process into your residency?
It was very smooth. I actually applied to 3 or 4 programs in the Maryland, Baltimore area, and then I ended up signing out of the match to the hospital that I chose at Sinai, which was just a perfect match for me. Once I did that, I was so happy.
So you said you applied to 3 or 4 programs?
Yeah, because I was limited to Maryland.
Do people normally apply 3 or 4 programs?
I don't think so. I think people usually apply to more programs. I think because I was sort of geographically limited, I couldn't really apply to more, because then my husband and I would have to be long distance for another 3 years. And that just kind of wasn't an option that we were willing to pursue.
So you chose your program because of geographical reasons. Was it more difficult, you think, as an DO student?
No, I didn't feel that way at all. In the residency program that I did, there were many DO residents as well as foreign medical graduates, as well as general MD graduates. So it was just a smattering of a lot of different people.
We've kind of talked about your residency a little bit more, but what was it like? And were there any specific highlights or proudest moments that you had?
I did really enjoy the clinic that I worked in once a week. It was called Green Spring Pediatrics, and it was kind of where I wanted to get a job if we ended up staying in Baltimore. It was this perfect setting with these amazing pediatricians who had dedicated their lives to academics, but also to their patients. And it was just a really special experience. So that was priceless.
Yeah, what do you think was so special about them in particular?
These doctors were kind of one of a kind in that they really had a passion for creating terrific pediatricians, sort of generating amazing, knowledgeable pediatricians that would go on to practice outpatient medicine effectively and know exactly what they're going into. They just had a real passion for teaching in a way that not everyone does. I mean, there are a lot of people that teach in academic centers, but their goals are different. So maybe there's some research component or whatnot. And these people, their sole focus was to make us great pediatricians. My mentor in particular, who was in charge of my pod, my clinic, was just this salt of the earth guy named Ozzy Taub, who he's an adolescent specialist, and he was one of a kind. He wanted to teach us everything he knew, and he just was so easy to interact with and ask questions. He was approachable. He was just the most adorable person. He came with his little bow tie. He was just like one of a kind. I've never met anyone like him again.
What was your experience looking for a job like?
So that was actually quite challenging because I was in Maryland and we were trying to relocate back to New York. At that time, we had one child and we thought it would be better to be closer to home, similar with the whole med school thing, the support, the family, not being estranged from family. So I was doing it remotely, which was a little bit difficult. So doing a lot of telephone interviewing and then having to sort of schedule interviews during times when I wasn't on rotation or just trying to squeeze it in. So it was a little bit challenging because it wasn't local. I had been offered a job at two different practices, and then that became just a decision tree, how to navigate that. And that actually was very difficult because the practice I felt most comfortable at actually wasn't what was going to work out in terms of contract and things like that, which was hard for me to understand and wrap my head around because I just thought it was a perfect fit. So that was disappointing. And I ended up going with the second choice practice, which I spent 11 years there. And it was an amazing learning experience, but definitely not as comfortable and sort of warm and fuzzy as the other practice.
What are the pros and cons of the choice?
So the pros were definitely the education factor. I was working with seasoned pediatricians who had been practicing for over 20 years, both of whom had very, very good breadth of knowledge and were very good clinicians. So I was able to learn and absorb an enormous amount of stuff from them. The cons were the geography. It happened to be 40 minutes of a commute to the office, which was really tough having young kids. And also the hours were not ideal. There were 2 evenings that I worked till 8 o'clock and one till 6. And so that meant missing dinner time, missing bedtime sometimes. And it was really not ideal.
That must have been hard with the young kids.
Yes, it definitely was. And they were young at the time. So you're missing out on that special time. The thing that was most difficult was that then translated into a babysitter, a nanny, doing the things that you kind of feel like you should be doing. That was upsetting.
Was it kind of a feeling of guilt that you couldn't be there?
Yeah, I think so. But in my day-to-day life, there was so much fullness to it in terms of my responsibilities and what I had to do that I didn't think about that very often. I would think about it more so at quiet moments where I could reflect, which wasn't very frequently. But so it was kind of as if I was plugging along, doing what I needed to do. And I would every once in a while take a deep breath and say, wow, look what I'm missing out on. And I think that sort of brings a later question into view in terms of being a pediatrician and how that works with hours and availability. Being a pediatrician means that you have to be available after school. So kids get sick and then they want to come in after school, or kids have a checkup scheduled and school-age children do not want to come in during the day to have their checkups because they don't want to miss school. Now, with COVID, it's been a bit different, but usually the main hours that are of most heavy traffic are between the hours of 3 and 7 p.m. So a pediatrician needs to be available during those hours, which is very difficult for working moms.
So you said you were at that practice for 11 years. Was there something else involved that made you change your practice?
The changing of the practice was basically because of the hours and the commute. So the structure of the associate physicians in the practice I worked at was pretty structured, and there wasn't a lot of flexibility. So you needed to work those late hours. It wasn't really flexible to not be working those late hours. And that just wasn't working for my family anymore. Actually, as my children got older, it became more challenging because they were involved in more extracurricular activities where I needed to be present to take them to games and sporting activities and things like that, but also needed to be around more for homework and for the responsibilities that they had. I needed to oversee that. It wasn't okay for me to be gone all of those evenings.
What is your practice like now?
So 10 minutes to get there, which is amazing. And just in terms of the hours, it's basically 8 to 5, 3 days a week, and half day on Saturdays, 1 in 3 Saturdays.
If you could have done a different specialty, would you go back and choose a different specialty, or do you think you are right where you're supposed to be?
It's so interesting you should ask that. I think that I was born general pediatrician, but sometimes I do think about how I would be in an academic setting where I was teaching and seeing patients the way that the physicians that I was telling you about at Green Spring Pediatrics were structured. That, I think, might be my ideal job, where I could teach medical students how to become good pediatricians, but also still practice pediatrics myself.
Do you think you would ever consider that maybe as your children get older and you have more free time?
Absolutely. It's kind of a dream.
So we're going to switch gears a little bit into the financial end of it. Did you take any loans for medical school?
Yes, all 4 years.
Do you think that was hard to pay back after?
Oh, yes. Yes.
Do you think the finances affected your choice of specialty or residency?
It didn't, because I didn't even think about it. When I took all the loans out, they just were these phantom numbers that I just kept in the back of my head and knew were there, but I didn't use them as a tool to figure out what to do in the future. I kind of just went with my heart and what I wanted to do, which I ended up choosing something that was on the lower paid aspect of physicians, but I wouldn't have changed it, but I didn't consider it.
Do you have any advice for current students regarding the cost of medical school?
I mean, I think that my biggest advice would be for the choice of undergrad. So if undergrad is not being paid for, then my choice for people going into medicine would be to go to a state school and cut the costs for undergrad. If you know you're going to do medical school, most medical schools are pretty expensive, except for NYU, that's free, to sort of cut costs in the 4-year aspect, because the 4 year is kind of cookie cutter in terms of the prereqs and stuff like that. And yes, you do want to have an excellent college experience and to be able to experience taking interesting classes and stuff like that. But you can do that for a lower price, I think.
What does your spouse do?
He's an ophthalmologist and actually an oculoplastic surgeon.
He has always been supportive of your career?
Absolutely, 100%.
Yeah, and I'm sure being a doctor himself, he probably understands the stresses that come along with it better than anyone else probably would.
Absolutely. He definitely understands what's going on day to day more than anybody else in my life.
Can you tell me one thing that you think made you successful?
I think my work ethic, that is definitely what's sort of driven me. When I think about my family, my father also has a very strong work ethic, has worked, 10, 12-hour days since like 18 years of age, and gave that to me. I think my mom also was in healthcare and was a nurse, and she also was pretty, passionate about working. And I think that my work ethic has really been the biggest plus in general.
How do you maintain your work-life balance?
I think that I try to exercise, definitely less so now with the children being home and us, having the quarantine situation. But exercise is really what kind of keeps me balanced, whether it be biking, doing the Peloton, running. Those things are what kind of keep me sane. So that's how I sort of balance out. The other thing I like to do is read. I'm a big reader. So I don't watch a lot of TV or get into that sort of thing, but I read lots of books. So that's kind of how I balance out the other stuff.
What are your thoughts about OMM? Do you incorporate that into your practice?
Unfortunately, not much, because in pediatrics, it's kind of difficult to do that. But I do refer out sometimes to OMM specialists that will see my pediatric patients and do, comprehensive evaluations and treat them. I do strongly believe in OMM. It just wasn't something that I was able to implement in my practice because I just felt that I didn't have enough training after medical school. I did an allopathic residency, so there was none of the OMM infused in the residency program at all. So I felt I didn't have enough what I had learned in school to sort of implement it in pediatrics. It's hard to implement things in general in pediatrics because they're little kids, so it's hard to do those sorts of things.
We talked about this a little bit, but I want to brush on it again. For any students who are considering pediatrics, what do they need to know about calls? Do you get a lot of phone calls? Do you have to be there when babies are born?
So in terms of calls, it's very variable. It depends on the practice that you're in. The practice that I was previously in for 11 years, I would get 10 to 15 calls a night when I was on call. And then on the weekends, it was double. It was a lot of calls. We were a 6-person practice, so you can only imagine how large the patient population was. I've sort of cut that in half now. I'm in a 3-person practice, and there are nights that I don't get a call for nights when I'm on call. I get 1 or 2 a day, very infrequently, and it's something that was a big shift from the other practice. So I think it's very dependent upon the practice that you're in, and also so how large it is, but also the patient population, because there are some patient populations that are more demanding and will call more often. And there are some patient populations that are not like that, where they kind of respect the doctor's time and privacy and family time and things like that. And they only call for emergencies.
Your husband is a physician. What are the challenges with that and with having the kids? Are you guys ever on call at the same time? Is it hard to decide on things like grocery shopping or making dinner?
We definitely do a much better job of sort of delineating responsibilities now that I'm part-time. So I basically do most of the food shopping, the schedule organization for the kids and stuff like that. And then he will do more of the finance stuff that he could do after work, get online, pay bills, things that are more flexible in terms of time. He tends to work more hours during the week, so he doesn't have time to do the errands and such. So I tend to be the errand person, and then he's sort of dealing with the bill paying, finances, things like that. So banking and all those things. And that's kind of how it works for us. But he also will, in terms of cooking and dinner prep and stuff like that, we definitely share the responsibility with that.
You were in a private pediatric group and now you're in a large corporate group. What are the pros and cons of those two different practices?
So the pros of being in a larger group in terms of, I work for a group called Pro Health, which is owned and operated by Optum, which is affiliated with United Healthcare. So it's kind of like this big situation. But the thing that's positive about that is that as a member of that institution, when I bill, I'm able to bill a little bit differently, a little bit higher because I'm part of a larger group. So the insurance companies will allow you to bill more for your services. But so that's definitely a positive. And whereas in my other practice, the small private practice, there was this constant pressure that we weren't billing enough and that we weren't doing enough. So now I don't ever have that pressure at all because I think the compensation factor is just different and the model is different. The one thing that's a little bit negative is that, when you're a part of something very large like that, if you want to get something done, for example, if you want to get your office painted, or if you want to get a new fax machine, or if your refrigerator is broken, you got to go through the system, which is a little bit different.
So for the women out there who are trying to choose a specialty, do you think that going into surgery is a bad idea? Do you think that pediatrics is a better specialty? Or do you think it's just, you do what you do and then you find that work-life balance?
I think it's exactly what you said. You have to find your passion, figure out what works for you. You don't want to choose something because you think that it'll be better with having a family. I know so many surgeons that manage. I have a plastic surgeon that I refer to all the time, and she interestingly adopted a set of twins and then became pregnant, like within a month of having adopted these twins.
Oh, wow.
She didn't think she could become pregnant. So she has 3 children under the age of 3. I mean, she does it and she loves what she does and she loves being a surgeon and it's what her passion is. And she's able to manage it. Yes, she has a lot of help. She has babysitters. She has a husband that stays at home. I mean, yeah, but this is where she's happy. This is what she wanted to do. And she's able to sort of negotiate it, even though she's got this crazy situation.
So along that lines, getting help do you have help from your family with the kids, or now that you're part-time, do you mostly do it yourself?
No. So I have a babysitter that's part-time, and then I have 3 sets of healthy, wonderful grandparents who are amazing. So my parents are divorced, so my kids were benefited with having 2 sets of grandparents on my side. And then my husband's parents are just, salt of the earth, would do anything for us.
That's awesome. It's often said that pediatricians are underpaid. Do you think that this steers some students away from this specialty?
It's so funny you should say that. So similar to that whole phantom number with the loans, that's kind of how I always looked at salary too. I never even thought of it. I just thought, okay, this is what it is. And I never really compared it to anyone else or anyone else's salary or talked shop with anybody. And it wasn't until I was a part of a pediatrician mommies group on Facebook where I was just looking for clinical stuff, like if I had a question and I wanted to post it. And a lot of pediatricians would bring up that fact about being underpaid. And of course, I make a different salary than my husband, who's a surgeon. So yeah, I know that, but it never really bothered me or deterred me. But I definitely know now that is true. It kind of stinks.
We interviewed an anesthesiologist and she said that she loved peds because of the kids, but couldn't do it because of the parents. How do you feel about that?
You definitely have your challenges with parents. I mean, you are basically seeing not just your patient, but you're seeing the parents too. But I actually find that very challenging, but also extremely rewarding. Like I was doing a telehealth last night with a patient and her mom, and the mom at the end just looked at me and said, "We're just so grateful that we have you. My daughter is so grateful, but I'm so grateful." And you really do get that from the parents. Like you make an impact on not just these children, but on these families, and you play a role in their lives. It's extremely rewarding. There have been my share of parents that have driven me nuts. I mean, they definitely can be overwhelming and overbearing, and there is a lot of conflict between the children and the parents and between me and the parents and such. But overall, I enjoy that. I think there definitely can be a struggle with, you have this adorable, sweet child in front of you, and then you have a mother who's sort of yelling at you about, why do you want to give this? Why do you want to do that? Explain to me why I need to give this vaccine and things like that. And the child's just kind of smiling and, in the background. That can be frustrating, but it's a challenge that I feel that I'm able to meet. So I'm actually okay with it.
But I have one more final question for you. What is the best piece of advice that you got throughout your education that you would like to pass on to other students?
I think the best advice that I received was to always approach situations with an open mind and to always approach every patient without any judgments. It's just this open mind. This is a patient. This is you. The two of you are here. And let's just put everything else aside and focus on the patient and you. I think that's the most important thing. Trying to put blinders on and just kind of focus on what's important, the patient and you.
Yeah, I agree. That's beautiful advice. Well, thank you so much, Dr. Lanzillotta, for doing this interview.
It was my pleasure. Thank you for having me.
This concludes our episode of Do or Do Not. Send all inquiries, comments, suggestions, and even let us know if there's someone you want us to interview to doordonotpodcast@gmail.com. Don't forget to like us on Facebook at Do or Do Not Podcast for updates. If you enjoyed our podcast, please share it with your classmates and administration. We have plenty of more interviews lined up, and we're excited to share them with you. This is Tian Yu Shea. Thank you guys so much for listening to Do or Do Not.